All right, good morning.
Hello.
Morning, everyone.
Hi. Happy Friday, everybody.
Yeah.
Yeah, happy Friday.
Welcome to another riveting episode from the Proactive Health Collective of Keene. We have with us today, we have Rebecca Montrone of Wondrous Roots and Drs. Tisa and Dr. Matt Abatelli of Cheshire Wellness. Today we're missing Dr. Gene Clerkin of Monadnock Health. We hope he's doing well. We'll miss him. He always delivers so much great content to us, but I'm sure between the four of us, we have plenty to talk about. And
we love you, Gene.
Yeah.
We'll see you next week.
Have a good weekend.
So today we didn't have a really set topic. A lot of times we kind of choose one topic and just go for it. But today we want to talk about a few kind of different things, some ideas that we've been thrown around amongst ourselves. But we'll just kind of leave it as a free-for-all and see where the conversation takes us. And I see we've got a few people logged in, joining us live. So now's a great episode. If you guys have any questions about anything or you want to steer the conversation, please feel free to write something in the chat bar to us.
Yeah, there's a Q&A down there. So if you click on that and you want to put in a comment or a question or anything, you can do that. I know as well that we're live on Facebook, and a lot of people tune in that way on the Proactive Health Collective of Keene Facebook page, and then it gets shared to ours. So I don't know if any of us monitor that for comments and questions.
Not live. No, we don't monitor it live. So hop on the Zoom.
Yeah, so if you want to do that, come in on the Zoom, and we'll be able to. Don't feel vulnerable when you come in on Zoom like somebody's going to see you. You're not going to be seen. People think I go on Zoom, oh my goodness, there I am. Or that we know who you are. We don't. You're completely anonymous if you come in on anything.
The webinar platform is different, just so you know. This webinar platform is different than your normal Zoom call.
Right, exactly. So
that's a really good point.
Yeah.
Well, to kick us off, something that I was really kind of passionate about this week, you know, we all see our clients during the week and different things come up, and Rebecca and I were talking about the importance of emotions and how oftentimes we're so apt to suppress them and mute them because they can be uncomfortable. And we don't really have any education or training how to deal with our emotions in life. You know, we don't really get a whole lot of that. What was that movie that came out, animated movie where they had the different emotional things in the head? You know what I'm talking about?
Yeah. Oh.
Anyways,
yes.
It was a great thing, I think, for kids. And they had the disgust character, and that's what that feels like. And it was a really nice way to sort of portray the emotions. But, you know, I know myself growing up, I didn't have anything like that. And we often don't know what to do. And emotions they're the juice of life. You know, they really, in my opinion, make life worth living. It's what being human is all about. So we were talking about the importance of not muting them, and also how can we work with them. You know, in Chinese medicine, emotions are of course very healthy, but they become problematic when they're not expressed. So when we repress the emotions in our body is when they become a problem, and it can actually manifest to physical disease later down the line. Yeah, does anyone want to jump in there?
Well, I will say that when we were talking about that, I was just sitting here and I just popped like a tincture in my mouth. You and I were Zooming, and I went like that. And you said, what did you just take? I said, it's called Comfort and Joy. And I just did it because I like herbs, and I happened to have this on my desk because I was giving somebody some the other day. So Comfort and Joy is a combination of plants. This particular hawthorn berry, motherwort, mimosa bark, rose petals, and devil's club. And these are plants that help you embrace your emotions. So if you're grieving, if you're going through a trauma, say you lost somebody, or you're moving, or you went through a divorce or bankruptcy or whatever, you went through something hard. Western medicine's way is to write you a prescription for an anti-anxiety medication, some Ativan, and an antidepressant. And what do those things do? They mute your emotions. They just kind of put you into a flat zone. So we don't want to do that. We want to offer help. We want to offer things that help strengthen and comfort you. It's very interesting in botanical medicine. These are all herbs that are great for the physical heart, but they're also phenomenal for the emotional heart. And so what we want to do is we want to use things like this that help embrace you, but help you not mute it out. If you need to grieve over something, if you need to work out something that's going on in your life, you need to face it and you need to experience it. I mean, if you've lost a loved one, you may need to wail and cry, and this may go on, you know, off and on for over a year or so. So you don't want to just be on an antidepressant that keeps you feeling like, you know, I couldn't cry, I can't laugh, I can't cry, but I can go to work, you know. It's not healthy.
Yeah. Yeah, being like in the present moment is something that's kind of becoming like a cliche term now. But, and, you know, I was thinking, what does that really mean, to be in the present moment? Because so much of our emotional discomfort is from living in the future or living in the past. If you read Eckhart Tolle's The Power of Now, he talks a lot about that. And so how can we be in the present? What does that really mean? And I think that, you know, putting some thought into it, what it really means is just observing. So just observing where you're at and what thoughts come into your mind or your emotions. How are you feeling? And the key is to not identify with them. Don't judge them. Don't create a problem out of them, but just to observe them. Somebody, when I was living in New Mexico, gave me a really nice analogy for meditation. And she said, you know, it's great to visualize that you're sitting beside a brook and there's all these leaves on the brook that are floating down. And each leaf is a thought or emotion or something you become aware of. And you pick up the leaf, you look at it, and then you just put it back down and then you watch it float away. And then you can do that with each of the leaves. And so it can be, it sounds very simple, but sometimes the simplest things are the most effective things. So
Yeah.
that's a nice way to kind of deal with uncomfortable emotions.
Yeah, absolutely. And that is a great visualization that people can use. Allison, I know you have mentioned that, or we've talked about it before. It's really, really powerful for sure. Your movie, by the way, is Inside Out. Had to look it up. And great idea to see how our emotions run inside. And if you haven't seen the movie, I highly recommend it, because your emotions are super powerful, and our being in this particular world is based on emotion. And if we suppress those emotions, it's going to create pain, and it's going to create it in many different ways for many different people. It could be a physical pain. I think, Allison, you might talk or have talked about holding it in certain organs. And in our line of work with the nervous system, we see that energy in motion is emotion. You need to move the energy. And I know we've spoken about antidepressants and anti-anxiety medications before and what they do to our system. Like you just said, Becky, they depress everything. They're not just depressing, like medication doesn't know that you're feeling anxious or depressed. It's just to decrease your baseline to where you don't feel anything, right? And Becky, you were just discussing that, and that is true. You don't feel sad, you don't feel anxious, you don't feel happy, you don't feel joy, you don't feel anger, you don't feel anything. And that is not how we're supposed to live. And more people are getting on anti-anxiety and antidepressant medications because they don't want to feel something. And in my personal experience, my mother was diagnosed with breast cancer a few years ago, and everything is fine now, but she had done a test through the line of work of what Dr. Jean does, the standard process testing, and found out that she was holding a lot of frustration, guilt, anxiety in her organ systems. And like I don't know exactly how this test works for sure, but I just remember hearing it, and like she heard it, and the guy kept going on and on and on and on and on about it, and then she just started just losing it. Like she just started tearing up, and I was like, okay, enough. She gets the point. We get the point. You know, we've got some work to do. It's okay. And when you have cancer, one of the biggest things is the anxiety of having the cancer. You have that stress, right? And they put you, I think it's on Prozac or Zoloft. I'm not savvy in medications, but
Yeah, those are similar. They're both SSRIs.
okay, yeah, thank you. And so that's to suppress that anxiety behind it. And it's actually muting how you actually feel about how you're feeling. And that's not a healthy state. And in our line of work, sometimes we've learned that if you aren't with your bioenergy, your life force, your, you know, connecting with your immune system, if you don't feel that and you just jump to pure awaken, like an energy level of bliss and feeling wonderful, you're not gonna connect with that. And it actually, your lower levels of your brain, it can actually kill you, because you need to be feeling angry about the fact that you, like, if that's how you actually feel, to feel anger about having, like, why me? Like, it's okay to be upset about that kind of stuff. It's okay if you're really sad about it or frustrated about it, but you need to feel those feelings instead of suppress, because ultimately it's not going to change anything. And Matt, I know that you probably have a lot to say about this, and I do want to come back around. I want to give the floor to whoever wants to speak, but I do want to come back to Bruce Lipton's biology of belief when we've said a couple things. So whoever would like to go next.
Well, Matt, did you want to follow that, or you wanted me to break you guys up, stand in between you two there? Yeah.
No, don't break us up, Becky.
No, yeah, I don't want to break you up. I think that what you said was really important, is that, you know, there's even, like, I often refer to the Bible because that's my belief system. And there's that statement that Jesus said, be angry, but don't sin. In other words, you can be angry and not have an anger management problem. Okay. So, but you have to be angry. If there's injustice going on, if there's something going on that's wrong, you need to be angry about it. And if you just say, well, I'm not ever supposed to be angry, that's not who we are. We do get angry about things, and we need to, but we don't. That doesn't mean we have to take a baseball bat and break all the glasses in the room, you know. So yeah, I mean, there's a thing about having emotions serve us. Let them be there so that we can integrate with what's going on in our lives in a healthy way, but not have them now take us over. In other words, we should be in control of our emotions at the same time that we're allowing ourselves to experience them. We should be able to, you know, to say, you know, yeah, I really want to cry about that, but I don't want to just like bawl about it in front of my client right here. You know what I mean? And just kind of like have them serve us. They should serve us when we're laughing, when we're crying, whatever we're doing. It should be something that helps us, and it will help us in a healthy way. If, like Allison was saying, if we don't bottle things up.
And I think that's also where observing can come in really handy, because, you know, you can't, like you said, Becky, you can't bawl when you're in the middle of your workday. You know, you're in the middle of a meeting and you're sad because something sad happened. You can rightly be sad, but it doesn't mean that just because you can't express those feelings right now, that you have to repress them forever.
Right. Yeah.
And that's when I think you can sort of observe, I'm feeling sad, and that's okay. And go on with your day until you have that time, and you give yourself that space, and then you can express those emotions. One thing that's really cool is in Chinese medicine, like I mentioned, when the emotions get repressed, it creates stagnation in the body and the energy. And when the energy in the body is stuck or stagnant, then the blood in the body is also stuck and stagnant. And so you can use a modality. One of my favorites is called Gua Sha, and it translates literally to scraping. And that doesn't sound really nice, but it's one of my favorite therapies, and I love it. My patients love it. And you can go to the area in the body that the emotions are stuck in. So for example, the lungs govern grief, So if you have a lot of grief or sadness that you haven't been able to express and you feel like you're carrying it around with you, I'll Gua Sha the muscles in the intercostal area between the ribs, and you just use a scraping technique. I use a ceramic soup spoon because it fits nicely in my hand. I have friends that have gone to China and seen people walking around doing their neck with a bottle cap when they have sore throats. It's really popular in China. But you just kind of scrape the skin, and wherever that energy and blood has been stuck in the body, it comes up to the surface, and you call it Sha, or redness, and you can actually see it. And it's like you're breaking the capillaries, you're creating a bruise in the body, but it only shows up in those areas where things have been stuck. And getting all that stuff up, and you're circulating it through the lymph system, and getting, everybody says afterwards, you feel a little bit like beat up because you've just kind of created a bruise in the body, but it's like you feel emotionally lighter. You're just not carrying so much emotional weight anymore. And between the scapulas and the mid-back regions, a really nice place to do it, especially with our go, go, go mentality that I always talk about, those kind of like anger, frustration, the liver chi that gets stuck because we have these plans and these visions of things that we want, and there's so many like restrictions or reasons why we can't act that out. So things that get stuck there and cause like irritability, anger, the mid-back between the scapula is an awesome place to Gua Sha as well.
Wow. Now let me ask you this. Are you saying like if you did that spoon like on a larger area, right? The bruise is only going to happen where the problem was.
Right. Yeah.
Very cool. I imagine that creates a good amount of connection through the system also, because then you're accessing all of these different bodily systems.
Absolutely. Yeah, sometimes I'll do a little bit of like light Gua Sha before a treatment, like especially with musculoskeletal pain, because it'll open up all the pathways and get things circulating, and then the needles have an easier time kind of doing their thing.
Wow.
Yeah.
Wonderful.
Cool.
Yeah, I think, we're talking a lot about, how things get stuck in the body, and then also how to liberate that. So a framework to look at that could be that we look at what's, binding in the body, what is sort of stuck, or so that bound type of, we're tossing around the term energy here, right? And we just acknowledge that, energy is the very essence of life. It's, without that, there is no life. And so that force that is created that makes everything hum. So if it's bound up and it's getting sort of compressed in an area, it stands to reason that it's going to cause issue. And then when we have different ways of liberating that and creating more connection, so we're going from a disconnected state to a connected state, that offers the body the opportunity then to do something about it.
Yeah.
Yeah.
So talk about that in terms of what you and Dr. Tisa do, because that's what you're all about.
It is. And I would say at the very foundational principle of the chiropractic profession, it's what chiropractic is all about. What we're looking at is we're looking at connection within the body, specifically the nervous system. We are acknowledging that the nervous system is master control, that everything flows through the nervous system. Doesn't matter what it is, whether it's a thought, a feeling, emotion, physical activity, sleep, rest, digest, fight, flight, all of it's running through the nervous system. So when what we look for in our practice is we look for a system, entire system. So nothing's an island. A lot of people think chiropractic, back pain. Sure, relieving back pain with chiropractic, the relief of the back pain could be a nice side effect of a properly functioning nervous system. And in fact, it's so reproducible that most people think of it as therapy or as an alternative to other methods. But what I would like to say here is that, and I may upset some people out there with this one, but chiropractic is not an alternative to health, to most other types of healthcare. So it's not an alternative to, getting a steroid injection or cortisone shot or, anything like that. It's in fact a completely alternate approach. So we step from looking at a symptom as something to get rid of, so something we want less of, something that if I had scarcity of pain right now, I would be much happier, which of course, you know, happiness coming from happenstance is temporary. Becky, I loved when earlier you said joy. And that's something that we focus on here because you just can't mess with joy. It's a state and it carries throughout the whole body. And Allison, maybe you have something to say about how that moves through the body, because I know it's different than some of the other emotions. So when we're moving from that, basically that bound to an unbound state in the system, the entire system now is in a coherent state. And so if we define the term coherent, what we mean when we use that in the office is that it is a state of basically connection and harmony throughout every cell, tissue, and organ in that entire body, so that there is coherence. There's basically, we have these sensory motor strategies in our body. So your body deals with whatever it has to deal with the best that it can through its own ability. It shows up in your posture. It's actually really easy to see what's going on. And it's not some sort of like judgment thing, but it's rather like, okay, I know what's going on with this person. And we also can see now what this person needs more of. So we take a look at that. We look at the whole system. We see where are things bottled up? Where is there a lack of coherence? Where is it not coherent? And then what does this person need in their nervous system to create that coherence? That'll go down the rabbit hole of what we do in the office. But what's important to understand is that when you have connection, when you have coherence through your whole system, and also we were talking about the mind sort of going, when you have silence between the ears and you have peace throughout your whole system and you have connection of that system, and then the body has an idea of what to do with that emotion, amazing changes can happen.
Right. And there's a question that comes up that maybe you want to answer, Dr. Matt. So does being stuck emotionally mean that you're stuck in other areas of your life?
That's a really good question. So what we see is we have the opportunity in the work that we do to clinically evaluate the nervous system and the musculoskeletal system and the self-reported well-being of our practice members. And that's an important term, practice member, because people come in typically as a patient, they're looking to get rid of something. And eventually what they realize is that they want more of something else. They want more joy, they want more freedom, they want more flexibility. And when someone makes that transition, and I think, you know, any of the practitioners here and any of the practitioners listening would agree, they transcend the patient archetype and they become a practice member. And that means that they're engaged in their own healing. So when someone's engaged in their own healing and then they're self-reporting their own wellness, so we tread this, we want to know what is changing, because when someone has the ability to process emotion and it becomes free again, and I'm not saying some big like, you know, like tears and crying or like what we think of like as emotions being weak or unstable, that's not it. It's about moving something through the body that needs to be experienced in a good way. And then yes, it will ripple out into their entire environment, into their lives, into their relationships, into the work that they do in the world, into what they can see for themselves and their family in the future. It's absolutely limitless, and it comes from a system that is connected and coherent.
Cool. And then that's really awesome. So a follow-up to that, another question came in. And if I did, the same person, and if I did suppress my emotions, other than not having the richness of the emotions and potential physical disease, are there any other challenges that would present in moving through life?
Yeah, it would show a lot. Yeah, we could probably all answer that, right? So in terms of nervous system, it's just going to show a lack of flexibility, and that's going to show up as lack of adaptability, which is going to show up as a decreased resilience and a decreased sustainability of life in a positive trajectory over time. So yes, it's worth investigating.
Yeah, and it's going to cause stress. All right, because if you have emotions that you haven't dealt with, you're going to have, this is going to be in the back of your mind. I mean, it's just always going to be there. It's going to be this chronic stress. And stress, I always talk about the methylation process, and stress, we need to create methyl donors, methyl groups to all of our processes in the body in order for them to function up to speed. And that's what keeps us healthy. That's a big thing that keeps us healthy. And so stress is it really does that. So then we say, how does stress lead to cancer? How does stress? Well, because the stress is requiring you to crank out more methyl groups than you can keep up with. And so these things, many systems in the body break down. And I think a really good point is, things happen. And maybe it's a problem between you and another person and it makes you angry or something. And you need to resolve that. We need to resolve issues between people as much as possible. Forgive one another. When that's done, even if you're the person in the wrong, then what you do is you're free. All right. You said, I'm sorry, sorry I did that, whatever, whatever. And then you're free. It's off. But what a lot of people do is they don't deal with those things, and that turns to bitterness. And bitterness is the one emotion that you don't want. Okay. Bitterness never has a place because bitterness will rob you of everything else. So you can't carry bitterness is nothing you can carry healthfully. So.
One of the things I love about Chinese medicine, and I think all of our medicines do this in different ways too, is that, you have some repressed grief or some repressed anger, and you don't have time to go to a therapist and hash it out. And maybe you don't know a right therapist. And how do you deal with this, right? Do you journal and meditate and write it on a piece of paper, rip it up? Like, how do you get rid of this? How do you really express it? You can move the energy in your body that is this one and the same as that repressed energy by network spinal chiropractic work. You don't have to go into the verbiage in your head about it all. You can use herbs to just treat it. I feel like in a way in Chinese medicine, herbs, have moving energetics as well. So I don't know how you would describe it, but in acupuncture, we work with the directions too, which can be a really helpful way to work with it. So like grief is a downward sinking type of energy. That's why you feel like down in the dumps or just like heavy. So we use points that are uplifting, and it kind of counteracts it and moves it throughout the body in a healthy way. So like there's 4 points on the top of the head that raise chi. And there's some points on the lateral arm that are really good for raising the energy in the body. And these points are also very good for hemorrhoids and for prolapse because it's one and the same. The energy in the body needs to lift up. Anger raises the chi in the body. That's why you get a red face and you feel like flustered and you get this like anger coming up. So we would use points to descend the energy. So like gallbladder 21 on the shoulders. You could do some acupressure. It's like by treating your body, you're treating what you feel like is the mental mindset of these emotions. You don't have to identify with the emotions in this verbiage therapist type of way.
Right.
Yeah, absolutely. And it's interesting. So going, I wanted to tap on this, and Becky, you kind of started the conversation about the stress that plays into it. And I know we talk about this all the time because it's kind of the main culprit of most of our health concerns. And so if anyone is familiar with Bruce Lipton, he wrote The Biology of Belief. And one little blurb that I found going through the other day, he states, as presented in The Biology of Belief, stress is responsible for up to 90% of illness, including heart disease, cancer, and diabetes. And when an individual is in stress, the release of stress hormones like cortisol shuts down the immune system to conserve the body's energy from running away from a perceived stressor, the proverbial saber-toothed tiger, right? So stress hormones are so effective at compromising the immune system that physicians therapeutically provide recipients of organ transplants with stress hormones to prevent their immune system from rejecting the foreign implant. And so he relates this to the current situation with the coronavirus and fear, how we're more fearful. The stress of fear is playing out more than the actual, what the damage of the coronavirus does. And so, because we're more afraid of the virus itself. So stress plays a huge role in how we bind our energy. Like Allison, you're talking about unbinding it through the scraping, the Gua Sha. And when you're stressed, you're going to hold it in different places. And it doesn't have to be from right now. The stress could have started from the birth, being in utero. Like your mother could have been stressed. And there, I think we talked about this a couple weeks ago, you know, your mother could have been stressed while she was pregnant with you, and that imprinted on you, and your process coming into this world could have been stressful. So that also imprinted. And then you start to live life with an already compromised system because your nervous system was stressed to begin with. And that will play out. We just had a practice member come in, and we looked at her x-rays and we looked at her nervous system, and she's like, well, it's funny, it took 60 years for it to show up, but I know it's been there, because she expressed some craziness with her birthing process. And so, well, what she was told, and she's like, I totally believe that it was probably due to that. And between the ages of 0 and 7, we don't have the rational brain to think our way through life. We just take in and respond. That's why, you know, if you're holding a baby, and you pop a balloon next to the baby's like, and then all of a sudden, usually the next response is, you know, like they yell it out. They express their emotion of, holy geez, that didn't feel good. I have to respond. Give them a minute or two, and they're usually okay. They let it out. Have you ever been in, Matt, last time we were, you know, in an airport, you know, there was we were in line, you know, the line's going through the security, and there's a kid sitting on the ground, just sitting there screaming. Parents didn't know what to do, so they just let him do it. And we were just like, just let it out, buddy, just let it. Nobody wanted to hear it, but at the same time,
Everybody else wanted to do it.
I know, but we're all like, we feel the same way. It's okay. We totally get, you know, and he just needed to do it. Yeah, it lasted a lot longer than you wanted, but people don't want to feel that, so, or don't want to hear it. So they usually, it's okay. Shh, we don't want to hear it. Shush, 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 be quiet. It's not right, you know, and we are taught to suppress the emotion from a young age. And so as we get older, we continue to do the same thing. We don't say things that we really wanted to say, and we don't do things that we really wanted to do because we were taught that we shouldn't, and we make it wrong. And we also had another practice member voice a concern for himself, and he said it very nicely. And I told him, thank you so much for saying that. And he goes, you know, I have been not saying things for pretty much all of my life, and now is the time to say it. Like, I can't not say it anymore and hold it in. And we're like, yes, please do. We totally agree. And he's like, I felt much better after I said it. And I was like, awesome. You know, I don't want to say what it was, but it's encouraging when you start to release energy and you start to connect with your body again. You have the courage to say what needs to be, and you don't have to be mean about it. It doesn't have to be like, meh. It can be really, hey, I just wanted to let you know, this wasn't whatever it was supposed to be, or whatever, you know, the concern is. I didn't like that, or, you know, I wish you didn't say this to me, or I feel like you wronged me. Like, people are just afraid to say that, and it can really bind us and create tension and stress in the body if we do that long enough. Yeah,
definitely. And I think it goes back to Allison, when we first started out, you were talking about the leaves going down in the water. And I think, you know, it's that kind of thing of letting go, dealing with things and then letting them go. So we don't end up, we're constantly experiencing new emotions. We're constantly experiencing new events that prompt emotional response and things, but we don't want to not deal with them and have, you know, them all just collect inside. We want to deal with them, and that's gone. And I think a big part of that is self-forgiveness. A lot of times people, you know, get really hung up on, oh, I shouldn't have done that. I wish I hadn't said that. Well, guess what? It's already done. You know, if you owe somebody an apology, you do that, and then you forgive yourself, and then you let that leaf go down the river. It is totally gone. And I think a lot of times we can get really hung up on the past, whether it's what somebody did to us or what we did and we regret or whatever. We just you have to let it go. and move on. But we don't just say, well, I can't deal with all of this collecting stuff in my whole life, so now I need, again, I'm just using this as an example because we use nutrients like 5-HTP and herbs and things to boost the neurotransmitters, to work with what seems to need correcting, and a lot of times they do, but the medications tend to just sort of mute. They don't tend to really fix what's gone, you know, and they tend to mute other things. So that's why I always keep coming back to that. I'm not saying there's never a place for an antidepressant medication, and I'm not getting in the way. A lot of people have complicated psychiatric things going on. So I'm not saying there's never a place for it, but I'm just saying as a solution for, you know, I'm upset, I'm down because of something. You don't want to just flatten everything and just be kind of like,
Yeah.
And we see all of that in the practice too. And there's the folks that are doing that are just trying to flatten it out because they don't know that there's other possibilities. That's a really big one. They're used to the authority of going to the doctor and having them fix things. And so they fix things by putting them on a medication. And then it really does limit the bandwidth with what they can experience. And like you said, Becky, there are some cases where it's necessary, and working with those also. And what I've seen with those particular cases is that they'll continue to get more and more coherence in the system, and then they like hit a wall, and it's like that's just as far as it's going to go. And in that case, we make that beautiful, because that's what that situation is, and that's what's needed for that person. And then for other folks, there's a level of energy needed. So bound, unbound energy, right? So unbound energy is growth. And I think this might've been where you were going earlier, Dr. Tisa. So growth versus like bound energy, which is decay, right? So we can also say that if you're in a state of growth, you're not really in protection. And if you're in protection, you're certainly not in growth. So what will happen is when the energy state, so let's say that someone does make the decision to medicate, the energy state will come in. And if it accelerates the energy state, which also gives them more bandwidth and be able to interact with their emotion and their thought and their feeling and their body, then they may get to a point, and I've seen a lot of people get to a point where now they have enough bandwidth and they feel good enough in themselves, they work with their doctor, they decrease, in some cases get off it altogether. And then I've seen the other happen too, which is where there's not enough energy to drive anything in the system, and it's a continual going down. And I was really glad that you brought up that sort of like stuckness, and then how the stuckness is also, sort of like tied into forgiveness. That's really big, and something that we run into a lot in the practice. And what we usually find is that the stuckness is something, like you said, Dr. Tisa, between the ages of 0 and 7, and there's a forgiveness and an acknowledgement that needs to happen there. It's almost as if time goes away, and in turn to like create a story around what's happening in the physiology. Is almost as if like the current state of someone in their adult life is reaching back through the veil of time to that child that didn't get what they needed in that one moment when they were like 5 or 4, innocently so, and just letting them know, like, I'm here now and I see you, and I'm so sorry that I ignored you. And there's this exchange that happens, almost across time. And again, we're creating a story around what happened in the physiology, but it's important to have these stories, these archetypes, to know really like what is happening. It's like, Becky, you talk about the Bible a lot, and I love that because those stories, my goodness, like they're so simple and they're so profound, and this is it. This is the same thing, storytelling, reaching back through, I'm so sorry I ignored you, and gifting and accepting the gift too from that time and place.
yeah. And Allison and I were talking Wednesday about also, she's reading The Power of Now right now. Isn't that right, Allison? Yeah. So we were talking about, living in the moment. And like she was saying, that tends to be a bit of a cliche today, but it really is so vital. Like, I'll just give a couple of examples. Like this morning, I was like kind of coming up to, I'm just going to be screeching into my practice when I'm supposed to open. But I wasn't going to be like upset in the bathroom. I was like, putting my hands through my wet hair, and I'm like, oh, that feels so good. It's like, you're still going to be getting into work at the same time. So why do you have to like hate everything until you get there, right? Because you're like, man, I should be ahead of time a little bit here. I got to the door, and I'm standing out there. I'm looking back out the door as I come into the building, and there were a pair of sparrows just right out front, and just watching them try to catch bugs and things, and just noticing things like that. I think those types of practices are super healthy because they take you out of, oh, but I got to get in, and then what do I do? What's the first thing I need to do when I get into my office? I need to do that, and then I got to do that, and I got to make sure I get this done. It's just kind of like, well, you can't do anything about that while you're standing there. You can't do anything about that until you start doing those things. So why should you let the thought of, I mean, this is just really, this isn't big stuff, but I think it's the little stuff that really robs us if we don't pay attention. Why should you let that bother your enjoyment of watching those sparrows? Because you're not doing anything about any of those things until you get to your desk where you can do them. So just forget about it, just forget about it.
I listened to this podcast a while ago, and it talked about joy versus happiness. And it was talking about how they're two very different things, and that you can have joy no matter what you're doing, what you're feeling in life. And that joy may be just like, noticing, like, this chapstick has, like, I love this color purple. That's such a beauty, that makes me feel good, like, what can you find in your life that brings you joy? Just looking up at the sky and watching the clouds move, that can be very joyful, and you can find that in your life all the time. I think the key is that you need to have your energy moving, whether it's by these movements, like the SRI movements that you guys work with at Cheshire Wellness, and those can be really effective. Qigong movements, acupuncture, herbs, to just get your energy moving so that you can allow yourself to feel this stuff.
Yeah. Going back to the Bible, Jesus said, your joy no man takes from you. Okay. So joy is a choice, right? Nobody can take it from you. It's something that you decide. Somebody can change your circumstances. Somebody can put you into a bad circumstance and maybe you don't have any control over that, but they can't take your joy. And I think that that's always sometimes, something I'll say if I'm in a situation, whether it's at work or whatever, and there's something negative around, it's like, nobody can take your joy. If you give up your joy, that was your choice. And I think that is something that you can say you have control over, but you have to make the choice. You can't just go, let yourself just be taken, on a whim by somebody else's decision or somebody else's bad karma or horrible, attitude. They can't invade that space around you. They cannot. If you don't allow them, they cannot take that. You have to give it up yourself.
Yeah, absolutely. And it's interesting. You can create in the moment, in the now, and starting your day that way with the power of intention. So starting your day, and there's a couple rabbit holes I could go down, but the law of attraction is just that. So the power of intention is, like, Dr. Matt and I were talking about it this week. And, so we did it last weekend in our healing retreat that we went to. And so we started this week on our way to the office. We're like, so what's the intention for today? Or I wake up and I start thinking about that. And then we talk about it on our way to the office. And you don't have to have somebody with you. You can think about it and talk out loud on your way to work, as well. And creating a power of intention of what your goals are for the day, whether that's, I'm going to connect with that person that I haven't connected with, or I'm going to create ease and flow in my own system so that the day will go in ease and flow, and really, just create what you want for the day. And it takes, 2 minutes. It doesn't take, and really feel what it feels like, because you have to have the emotion behind that to really manifest it. And I'll tell you right now, we had a kicking week. Like, it was so much fun. And I actually went downhill on Wednesday. I was expressing health. Something was in bloom and I wasn't feeling 100%, which was fine. And we still had an awesome week. And so, but my intention was to still create ease and flow through the whole week, and each day change that just a little bit. So setting your intention, just like praying in the morning. Thank you so much for waking me up today. I get another day to do something magical in this beautiful earth, and taking the moment to see the beauty around us, which, by the way, Becky, are really fun. And anybody who comes into the Miller Forge building, there are some beautiful pink and yellow moths that are hanging around the entrance of the doors into the
And that's
building.
what the sparrows were trying to catch this morning.
Oh, well, don't let them do that. I'm just kidding. But I mean, they gotta eat, but that's what they are. But they're so pretty. Like they're,
Yeah.
my friend Desk Gal and I, we like stopped for a minute. There was a huge lunar moth that was sitting there, and then the pink and yellow moth and its mate right next to him. And we just, I mean, we literally sat there for like 3 minutes and looked at them, and they look like little cute, fluffy cotton balls with wings. And
Yeah.
they were so pretty. And so we're like, well, you know, they're going to get stepped on, so we need to move them because people aren't going to see them, you know, but we got to see that magic starting our day. It was really neat.
You're just like me. I'm like that. If I find a bug or something in my room, you know, I'll take it and gently try to lift it. I don't care what it is. If it's even something that you wouldn't really want. I mean, like, why are you just going to kill it? Because it doesn't want to be in your house either. You know, it just wants to get back outside. Just try to help them move them out of dangerous way. I find intentionally a big thing as a practitioner. Well, I think for all of us, but especially as a practitioner, is to remind myself to be listening and to have my antenna out, because you can get really caught up. So you're talking with a client or whatever, and you're not as receptive as you should be. You're not, you know what I'm saying? You're not hearing, you're not observing the way as well as you should. I just find to remind myself of that as a practitioner is to be in tune and to, you know, be in that listening mode. You know, and not listening doesn't just mean conversation. It means the antenna, you know, yeah.
Hearing what they're saying.
Yeah, or not even saying, maybe not even saying, you know, right.
Does anyone want to take a stab at this new question that we have? Someone would like to know, does any of this relate to COVID-19?
Well, sure.
That's a great question. Yes.
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 Entirely and
Yeah.
inseparable.
I mean, now more than ever, I would say there's just so many opportunities to get emotionally triggered in any direction. You know, there's so much information. There's so much doubt about if the information you're hearing is valid. Where is it coming from? You know, is it true? You hear this and then you hear that, and you know, there's a lot of confusion, there's a lot of fear, there's a lot of sadness and grief about just the restrictions that have been placed on us, for sure. So yeah, kind of what we're saying, just I think number one, try to observe it, don't judge it, just try to detach from it and just watch it and be okay with it. And then you can bring in some of the other things we've talked about, like setting an intention for your day. I'm going to, you know, today, maybe a great intention would be, you know, don't get emotionally triggered by any news that you hear.
Mm-hmm.
You know?
So, yeah, I
Hear
think,
any news.
yeah, don't hear any news. The fear is a stressor, and stress, you know, so we kind of talked about that. But what as practitioners, we've also like to focus on is I think we're all in agreement here that we think the fear is overblown as far as the threat to our physical state. And the recent second wave alarm is just really ridiculous when you look at, if you actually look beyond and you look at news that isn't, you know, David Muir, you know, trying to scare everybody, and he's just an example of that kind of big mainstream media news. But this was Dr. Fauci just on Tuesday before the Senate Subcommittee on Health, Education, Labor, and Pensions on Tuesday said that 80% of the 90,000 people, which seems like a low number compared to everything they're saying lately, but this was just Tuesday, who have been infected by the novel coronavirus, also referred to as COVID-19, spontaneously recover. And I actually I listened to him actually say this, so this is not erroneously reported, meaning that they get better without any specific intervention. Quote, and this is Dr. Anthony Fauci, if you look at the now 90,000 people who've been infected and the number of deaths that have occurred, about 80% of individuals who get infected do really quite well without any specific intervention. Namely, they spontaneously recover, Fauci said in his opening statement. Quote, however, about 15 to up to 20% of individuals, usually those who are elderly and in risk groups, wind up getting serious disease requiring supportive care. That could be oxygen, that could be intensive care, that could be intubation or even more dramatic interventions, he said. So we want desperately to have a therapy for these individuals. So now they're talking about like remdesivir, like an antiviral medication or something that he's saying is going to take a couple of years. But it's moving away from that whole thing. Oh my goodness. I mean, the whole world is just going to cave in and die from coronavirus. It's like 80%. This morning, one of the doctors on that committee that Fauci and Birx are on was saying, wow, you know, when you look at it, when you look at all these numbers, they're doing all this testing. We've only seen about 10% of the coronavirus pandemic. That's because like 80% have no symptoms, don't have a problem. If we didn't know about it, if it hadn't been publicized, we would have said, oh my goodness, something's going around. Some people are getting sick and having a bad time and dying, but it would not have ever been this lockdown. And they're now saying that it looks like evidence for resistance to SARS-CoV-2 is emerging. One study found that 40% to 60% of people who had not been exposed to COVID-19 still had resistance to the virus on the T cell. So they're thinking this is coming from people just having T cell modification through just common cold coronaviruses through the years. So I just want to say this. I know somebody's going to argue that and say, but read this or whatever. The thing is, our immune systems, again, were meant to be strong for us so that whatever comes around, we can fight. Again, survival of the fittest. The weak, the frail, those who are weak are going to succumb like they would to anything. And that's not to say their lives don't matter, but it is to say that's just the way it is when sickness goes around, no matter what it is. So, you know, I'm hoping, you know, my voice, I try to dispel the fear. Oh my goodness, because you do see so much fear, and it's real legitimate fear. Some people are, you know, they're like pro-mask because they're just pro-mask and how dare you not wear a mask. Some people are like pro-mask because they are literally petrified. And so that's the kind of person I want to speak to. Please, please relax. This is not what we've been made to think it is. And I also just on that subject want to say, why have the big voices, like very reputable voices like Dr. Joseph Mercola, who's an MD, Dr. David Brownstein, who's an MD, why have they been told they can't blog, they can't post things about vitamin D, vitamin C, selenium, zinc? Why? Because I can understand, like the industry has said to people like me, if you're dealing with cancer and you're encouraging people not to do things that are natural that get rid of cancer, and we do that a lot here, then what you're really doing is you're giving them false hope, and they're not going to do their chemo and they're not going to do their radiation, right? But when it comes to coronavirus, there are no alternatives. So if somebody does vitamin D and vitamin C and zinc and selenium and glutathione, and does these things that show strong evidence for being very helpful, it's not keeping them from doing a coronavirus legitimate treatment, because there are none. So why is there this opposition to telling people how to keep yourself healthy? And we have to ask ourselves that.
And is that binding energy or is that liberating energy? You know, if you look at that, and we look at this in terms of a social biology, if as a large organism, you know, I love that you brought that up, Becky, because I think, you know, the answer is pretty clear. Like, well, that is a bound system. That is a system that's binding energy, that's maintaining a certain focus, whereas a free system is one where it's inclusive, you know, and I think inclusivity is a very important concept here. And that if we look through the history at who our heroes are and who the best leaders have been, especially in times like this, when it's been uncertain and we haven't known where to go, or there's been, you know, the greatest generals in wartime, you know, they didn't go down in the history books because they, you know, were the steamroller throughout the whole war, rather. They went through into the history books because their back was against the wall. There were so many lives at stake, and they managed to create something with that. So look at that. I guarantee you that any of those heroes that you have in your life, those people that, and hopefully some of whom you are sharing attributes of, and that those may be attributes that other people could catch from you. Maybe that could go viral or viral or however we want to say that word now. But that they had an inclusive view. And I would also say that that could be the 1,000-foot view. One of my personal gifts in life is that I've just always had a 1,000-foot view. So while I'm, sympathetic to details, I don't necessarily live there. And so I see things from a height. And I would encourage you in whatever that translates to you. So if you can access that within yourself, if you can see that and not get too bogged down and wonder where to go, but to have a bigger picture. We've been talking about joy, we've been talking about connection. I'm talking about, basically like things that you can't mess with. And so I would invite you to do the things that bring that about, like sitting in nature. Dr. Tisa mentioned that she and I, took retreat this last weekend. Why? To immerse ourselves in something that would bring about a health in our system so that we could show up and serve this week. And as she also said, this week was amazing. Really, really amazing. We were seeing such incredible changes with people. Like, people are so lit up, and you take a look around and you think, well, how could that possibly be? What a gift that is right now. And everyone out there, you have the ability and the strength, the courage, the wisdom, and more energy than you'll ever need to do the same thing.
Yeah.
Kind of bringing together the point you make, is the energy bound or constrained. It's such a great way to say that, because it really simplifies it. And then connecting that with just observing, feel your body, just kind of check in. Are you holding? Are you breathing fully? Is there anything you can do to just move it and just start there?
And the mask is a great example of that, because as we've spoken about, let's first start here with compassion. Let's first start with compassion. There are a lot of people out there, as you said, Becky, who are very, very scared and who have some serious issues. So may we start there together and be stronger together, because all boats rise together. And from that place of compassion, then I would also ask a personal question of, how does it feel in your body when you wear that mask? Do you have a feeling of this freedom, this unbound, this absolute relief that for you, this is the right thing? Or when you put that on, do you not feel that way? Do you feel tension in the system? Do you feel bound energy? Is there an emotional component to it? And start with compassion and then ask yourself that question.
Good point. Yeah, I like that. We had talked, I had put out in my announcement today that we might touch on things for the brain, for traumatic brain injury, for preventing dementia and stuff like that. And we didn't get there. I don't think we were supposed to, but maybe we'll touch on that next week. But doesn't need to be a main thing, but I like what we talked about today. And I always, you guys say, I don't want to go down a rabbit hole. I'm like, please do, because I want to know more, like Allison, I'm like, just go into the depths of it, because I don't know anything about acupuncture except what I've learned from you. And I'm like, I'm learning. I feel like I'm learning a little bit every week. Yeah. And same thing with you guys. And of course I'm under your care and experiencing all of that in a very positive way. So that's really cool.
I'd love to learn more. Maybe next week we can fit in about the supplement that you've talked about for memory anxiety. So if you get stuck in a certain pattern, of triggered by this memory, you can actually use a supplement that helps the brain to heal.
Yeah, it helps it in many ways, but that tends to be one way to kind of turning off anxiety from something traumatic in your past, I got up to read my report in the 2nd grade and my class laughed at me. So now here I am, I'm 60 and I don't want to give a report at work, or something like that, because, but that can happen. I mean, just, you can get really scarred and jarred. Yeah.
I recommended that to a patient of mine that had, she was having some vertigo issues, and she was getting better, having less vertigo, but she said that it would she'd be so scared about it, it would almost create the situation.
Sure. Oh yeah.
All right. Address that part of it.
Yeah.
Great. Well, it sounds like there's a bunch of really good stuff for next week already.
Okay, well, everybody have a wonderful weekend. Thanks for tuning in. And we'll look forward to seeing you again next week. And my colleagues and Dr. Jean out there, be well, and we'll be bumping into each other along the way before then.
We love you guys. See you next week.
Take care.
Thank you.
Great weekend, everyone.
Bye.
Bye.